I'm going to set these right if we can. Well, here, let's just do this.
Good morning. I'm going to take the mask off so you can hear me a little clearer. Thank you all for being here. I want to welcome Governor Lee and Commissioner Piercy. Today is a historic day for the medical center. One of the first steps that we took back in March when the pandemic began to affect Tennessee was to designate a floor in our adult hospital for COVID patients. Fortunately, we had a brand new floor that was just beginning to open. We decided to do this so we could put all the patients in one place. And very simply, we call this our COVID unit. And I want to bring your attention to this group of folks over here to my left. We've got our Chief Nursing Officer for Vanderbilt University Adult Hospital, Robin Stevens, seated in the first chair. Then the rest of the individuals who will introduce, Governor Lee will introduce, are all frontline COVID staff, physician, respiratory therapist, environmental services technician, and 2 of our nurses. And these folks have cared for hundreds and hundreds of COVID patients that have been in our hospital. And they've been doing this, most of them, if not all of them, since March. And they self-selected to serve in these roles to care for these patients. This morning, I'd like to add that we have more than 140 COVID patients in our hospitals, with 120 in Vanderbilt University Adult Hospital. We also have several patients in the Monroe Carroll Jr. Children's Hospital, and then approximately 20 in Vanderbilt Wilson County Hospital. Since March, including this team of folks here and other members of our clinical staff, our frontline clinical staff, have cared for more than 2,100 hospitalized COVID patients here. And I'm pleased to report that more than 1,750 of these patients have been successfully discharged. However, it's unfortunate that I have to say that more than 200 of these individuals have died from COVID or complications related to COVID. And this is despite every ounce of care that our folks could provide, the very best technology, equipment, experimental therapies, and everything else that we could bring to bear. Excuse me. So, in recognition of this historic day, this vaccine that we will be administering today represents hope. It represents hope for our frontline caregivers, that they can continue to be healthy to care for the patients, and when we can begin to vaccinate patients, hope that we have an end to the pandemic. As one housekeeping item, I just wanted to say that we were on an ambitious timeline this morning. The COVID vaccine supplies arrive in 2 parts. One part is what we call supplies, and then the other is vaccine. The supplies are here and in our pharmacy. The vaccine is somewhere en route to our pharmacy as we gather here this morning. We expect to have it no later than 10:30. If it does arrive at 10:30, our pharmacist says that it will take approximately 1 hour to thaw the vaccine and reconstitute it, but we will have it delivered to the room here and will be giving vaccine to these individuals as quickly as possible. I will get a text anytime throughout this gathering this morning that will update me when the vaccine arrives. So with all that, I'd like to turn this over to Governor Bill Lee. Thank you.
Thank you, John. Thank you for the role that Vanderbilt has played throughout this pandemic, and the important role that you play even today. And thanks to you in particular, those of you who are here today that'll be the first recipients of vaccine, but who represent hundreds, thousands of frontline workers who have poured your lives into serving people in this state. We're grateful for your being here today. John, you talked about the over 2,000 patients that you all have taken care of here at Vanderbilt. That's a sobering statistic. And you also talked about those that didn't go home. For the families of the over 5,000 people in this state who have lost their lives to COVID, that too is a very sobering statistic. And it is very true that today's a hopeful day. People have called this a shot of hope, and we celebrate what is a historic moment and a turning point in this pandemic. But my message today starts with saying that we cannot look past the sobering reality of what we're facing here in Tennessee. The sobering reality that we are getting sicker in Tennessee by the day from COVID-19. It's a painful, sobering reality. It's harsh. It may even be inconvenient to some, but we have to talk about that today on the day when we are getting vaccine for the first day in the state. I'm joined by these members of the Vanderbilt medical staff who have been serving patients throughout this pandemic, and a respiratory therapist, an environmental technician, nursing officer. I can stand here and say that the direction of COVID-19 in our state is going the wrong direction, but these people have lived it every single day. They are the ones who see patients gasping in their beds in this hospital. They're the ones who have watched their patients go on ventilators for weeks at a time. They're the ones who've had to share the news with family members that their loved ones have succumbed to the disease while their family members wait outside of the hospital. We do stand here and celebrate a tremendous breakthrough in this pandemic, but there is a darkness before the dawn that's happening right here in Tennessee, and we have to recognize that. Tennessee's cases are surging. The holidays have caught up with us. Decisions that some made during Thanksgiving are having a severe reality in this hospital and all across Tennessee today. One thing that this vaccine will not solve, one thing that it will not cure, is selfishness or indifference to what's happening to our neighbors around us. This vaccine will not cure foolish decisions about how we gather. It won't cure an attitude of a refusal to wear a mask. And it won't cure the idea that I will take my chances and that will not impact someone else's life. I think Tennesseans have a tremendous capacity right now to responsibly make decisions that will serve their neighbor in the process. This vaccine is a very powerful tool, but it will take some time to have a real impact. And in the meantime, it is the very simple things that Tennesseans do that will help us turn the tide of COVID-19 in our state. Your decision, whether you've worn a mask ever before or not, your decision to wear a mask today, for example, may be the decision that keeps you from being treated by these healthcare workers in the weeks ahead. We can and we must turn the tide of COVID-19 in this state, and I need every Tennessean to hear that message loud and clear on a day when we are very hopeful about what these medical professionals and this vaccine will provide for our state. Before I invite Dr. Reese to talk about what this vaccine means for treating workers, for treating healthcare professionals in the hospital, I want to acknowledge the members of the team, again, who have served their state well. Tisha Akins, thank you. Thank you for making sure that this hospital facility is clean and safe for the people that you work around and for every patient that comes in here. Thank you for that. Lisa Flemons, thank you for using your years of intensive care experience to build a specialized ICU for COVID-19 patients. Vanderbilt's specialized unit has served many families well, and your expertise has been important there. Sophie Whitaker, thank you for keeping Tennesseans breathing as a respiratory therapist, for keeping life-saving breath during their most vulnerable and their darkest times. And Cody Hamilton, thank you for caring for and nursing Tennesseans back to health, fighting through some of the worst days of this pandemic. Robin Steben, thank you for leading nurses with confidence and effectively managing capacity. Thank you very much to every single one of you who have played a significant role, but really who represent the many, many folks who have to face the realities of this every single day. Many Tennesseans don't have to face that reality every day, but you do, and we're grateful for your continued work, and we want to be as great a support as we can to you today. Dr. Rice, finally, thank you for using your vast critical care knowledge to build one of the most successful responses in the country. It's one of the reasons that we are here, because of the successful response of Vanderbilt University and the model that it is to all of America. So thank you for your work there. And if you would please come up and share your perspective on what this day and this vaccine means to your team and to our state.
Can you all hear me with the mask on? It's good. Thank you, Governor, and good morning to everybody. This is a really exciting day for us. So as the governor said, all of the people over there take care of people who are critically ill with COVID in our COVID unit. And while taking care of people who are already sick is really important, we've known for a long time that the way we get out of this pandemic is by preventing people from getting sick and preventing them from ever getting the disease. And if you get sick, we'll take care of you. But importantly, we want to prevent you from getting sick. And the way to do that is through vaccination with an effective vaccine. And that process actually starts for us today in Tennessee, and that's really exciting. We know we have lots of work to do. It's not just the frontline providers that need to get vaccinated. It's the population to make this go away. But we know what our task is, and it's time for us to roll up our sleeves and get to it. So let's get people vaccinated, and let's get through this pandemic. Thank you.
Good morning. Thank you, Dr. Rice. Thank you, healthcare workers, John, Governor. We are very excited today that the mass immunization effort in Tennessee has begun. We have received, or in the process of receiving, 56,500 doses of Pfizer vaccine today across 28 sites to service 74 hospitals. We do expect one more shipment of Pfizer before the end of this year, but we also woke up to some really good news this morning, which is in the vials that we are receiving today, there is at least an extra dose, perhaps two, in the vials. So that will add 11,300 doses to the stash, to the supply that we're getting today. I also want to alert you to what's happening next week. So today and tomorrow, the FDA and the ACIP, Advisory Committee on Immunization Practices, are going to be reviewing the second vaccine candidate, which is Moderna. If everything goes as expected, that will be approved over the weekend, and we will receive a total of 115,000 doses beginning Monday through Wednesday of next week. These will be shipped directly to all 95 health departments, arriving as early as Monday. The Moderna vaccine is equally as safe and effective as the Pfizer vaccine, but the good news is that it has less stringent storage requirements. That's why we chose to send it out into the community, because they can handle it a little bit easier. That's where we will be vaccinating first responders, the rest of the hospitals in Tennessee that don't get the Pfizer allocation this week, and our long-term care facilities. Now, I realize there's a lot to keep track of, and there's a lot of changes and moving parts. So I also want to announce today that we will be rolling out our vaccine dashboard tomorrow. Starting tomorrow, we will publish it twice a week, on Tuesdays and on Fridays. And that will have details on doses administered recently, within the last 1 day, within the last 7 days, as well as demographic characteristics of those receiving the vaccines, including county of residence. Like the governor, I do also want to acknowledge the dark days that our state's going through and recognize the extraordinary work that our healthcare professionals are undertaking. And I, too, urge you to push so very hard over the next few weeks, because with the hope of this vaccine, this will be our last surge in Tennessee. Thank you.
Is that right, Tisha? Tisha, I think you might have been prepared to make a remark or two. Is that right? Is that a yes or a no? On my report, it says Tisha Aiken speaks for a moment. Would you come up and just share your experience? Thank you. I'm sorry to do that to you, but thank you.
Good morning, everyone.
Speak really loudly.
Good morning. I just want to say I'm just excited for the vaccine. It has been challenging working close to COVID patients, but I have made it through so far. And I just want to say thank you for my team, has pushed us, has been there the whole time with us. As a environmental service tech, it's a good department. We struggle. It's been stressful, but so far we have made it through. And I'm glad to be here and excited to get this vaccine to keep pushing through.
Thank you. All right. Thank you. I think your words express the struggle and the strain and the difficulty that's been over the last months, and why the job that you all do is particularly challenging, and Tennesseans are particularly grateful. So we're hopeful that today is in fact a hopeful day for all of you who know that in weeks or months we will have made a real turn in this virus. So thank you all. Very important message today. A lot happening across Tennessee, and be happy to entertain your questions.
Yes, considering there are a large number of people, a large percentage of people who are leery of taking the vaccine, what do you tell them to make them feel comfortable about this?
Yeah, we really know that this is a safe vaccine, that it is effective, it's highly effective. We also know that people have reservations about that. We know that Tennesseans have to make a choice as to whether or not they're going to take this vaccine, but what we want to do is provide as much information as possible so people can make that decision with all of the accurate information and not misinformation about this vaccine. The Department of Health has that information. Certainly the providers are the best resource for Tennesseans. Their doctors, providers like Vanderbilt University, trusted voices in their community, federally qualified health centers that are in communities all across the state are a very trusted advisor. Really, the healthcare professionals are the ones that need to be used. And let me just say, they've been tremendous partners. One of the reasons we're right here at Vanderbilt today is because of the partnership that the hospitals and the healthcare providers across this state have been, the partnership that they've developed one with another and with the state to get that information to Tennessee. And so we certainly hope that message and the importance of getting this done will weigh into the decision-making process Tennesseans have.
Andy? Governor, when do you plan to get a vaccination? Or when are you doing that publicly?
When it's, when the population that I fall into is in line for vaccine, that's when I plan to do it. Kimberly?
There is skepticism among some people about vaccines and such. Do you plan maybe to change your television and video, social media ads to try to reassure people about that?
Well, we're going to start with messaging from the very top down, just like today. So there'll be a number of approaches to messaging in the weeks ahead to encourage people to find out everything they can about this vaccine. But we certainly hope that Tennessee and the uptake will be strong, and it appears that it will be. Kimberly?
Hi, Governor. This question is for either for you or for Dr. Piercy regarding the 975 doses that we got on Monday of the reserve. I was curious if you could talk about why the state felt that was necessary, especially when the federal government is building up its own vaccine reserve.
Mm-hmm.
Why does the Tennessee need to build up?
You want to talk about that, Dr. Piercy?
So because of our wide and diverse geography here in this state and our strong commitment to reducing waste and spoilage, we felt it was important to send vaccine directly to the sites because of the very specific storage and handling requirements. The 975 doses that are held in emergency backup are for just that. If a hospital receives a case today and when they open it up, it's spoiled, out of temperature, or broken, we can immediately deploy that to them. Turns out waiting 72 hours has been pretty fortuitous for us because if we had started giving vaccine on Monday, we would have lost those 11,000 doses that we are going to get today. So looking forward to everybody getting a vaccine today that wants one.
Quick follow-up. According to the state vaccination distribution plan, you also have looking for a reserve for the Moderna. When will that take place?
So the reserve for the Moderna is a little bit different. It's not for emergency backup. It is for what is called a social vulnerability index. There are some for spoilage, but the smallest allocation of 5,000 is for the social vulnerability index. And that's because we want to prioritize those places that not only may not get them because they don't have as many healthcare workers or as high a population, but have some social vulnerability and want to be equitable in our distribution.
Memphis is really the center of medical attention for 3 states, and we've heard from people in the community there working on the front lines and other officials who've been seeing healthcare workers in Arkansas and Mississippi get vaccinated, and the sickest patients come to Memphis. Could you talk to that frustration and them not being able to get vaccinated for 4 days to this point? Could you talk to that?
Yeah, we do have some health systems in Tennessee that have out-of-state affiliates, both in Southwest and in Northeast Tennessee. And so the different federal shipping schedules did impact different states differently. Looking forward to get everybody vaccinated today when that arrives on site.
You want to go first?
Hi, Governor. Tennessee was ranked by the CDC in the top 5, actually number 2 for the cases for 100,000. Most cases were 100,000. Yesterday that came out. And also the Knox County Board of Health calling for a mask mandate. What's your response to that ranking, and what needs to change moving forward in your response to the Board of Health?
Yeah, I think that what I said earlier is that we're in a dire situation in this state. We're in a very serious moment in the pandemic. The country is in a serious moment. The effects of, in particular, Thanksgiving for our state have put us in this spot. It's why I made the remarks I made a few minutes ago. Tennesseans need to hear the message loud and clear that we have to make decisions as a population to stem the tide of this vaccine. The state is working very hard in partnership with our providers to provide additional testing and additional types of testing across the state to provide an infrastructure of healthcare capacity, designating more COVID-specific nursing homes, to provide funding for staffing for providers across the state, providing National Guard medics to hospitals in different geographic areas of the state. So there are a number of things. We just recently expanded scopes of practice so that we could add to the number of people that can treat and that can vaccinate. There are a number of steps that we can make, but we cannot make the step that Tennesseans have to take, and that is to make wise decisions, especially going into Christmas. How you gather in your family, what you do, the decisions that you make individually will have a profound impact on who is in this hospital or a hospital in your community in the weeks following.
Governor, I do have two questions. One, to continue from that one. You have continued to stand by your plan, saying that you all have a strategy that works, whether it be causation or correlation. We're number one
Yeah.
in most cases.
Yeah.
Looking at those numbers, looking at your strategy, is there any point where you may consider pivoting from that?
We look at and consider new strategies and new opportunities to serve. That's why we have that long list of things that we just talked about. And we will be looking at additional movement every single day. It's very evident that every state in this country is pursuing strategies to try and curb the spread of the virus in their state. Others, there have been periods of time where we weren't in the top 10, but we are today, and that's why my message is so urgent today to Tennesseans to take this seriously. We will look every day at strategies and tactics that we think will help mitigate the spread of the virus.
And my second question, Dr. Hildreth is advocating for teachers to be bumped up in the first phase. So with regards to schools, will you consider moving teachers up in the first phase of vaccination? And is there ever a day where we might see this vaccination being required for any students or faculty who have to return to the classroom?
Yeah, I don't think we're going to mandate vaccines in schools, but I do think that teachers are a high priority. And as you know, across the country, there are those priorities being set. The first priority being healthcare workers, long-term care facility residents, and that's who will be vaccinated with this first round. But we are setting in place and having those discussions every day about what those next priorities look like. And teachers certainly should be considered strongly for a high priority for vaccination because of the importance of kids being back in school.
Sorry. That's okay. A couple questions for you.
Mm-hmm.
There's a lot of people who don't trust this vaccine, as we've already stated, but especially in the Black and brown communities. What are you going to do to encourage them to make sure that they feel safe to get the vaccine?
Yeah, one of the things that we tried to do, beginning with our testing strategy across the state, because we recognized that people of color were not engaging in the testing process to the degree that we hoped that they would. So we engaged with partners. First of all, within the Department of Health, we have a Department of Minority Health and Disparities Elimination. We engaged that group, expanded it, began community outreach to African American churches, to Hispanic churches. We used public messaging through Spanish-speaking radio stations. We engaged with our federally qualified health centers in those communities that are their trusted voices in those communities. What we learned was that the messenger really matters, and so our desire has been to partner with those messages, including Fisk University and Dr. Hildreth, to communicate how important it is not only to get tested, and we used that experience that we had with testing and with engaging in a greater way communities of all types across this state. We used those partnerships and that infrastructure to begin messaging about the vaccine, and that's what we'll continue to do.
Okay, my next question is, what are you doing to ensure the vaccine distribution goes smoothly and is being properly?
I'm going to let you answer that question.
Yes, as you know, we have a pretty robust plan posted online, and that is solely the work of our pandemic vaccine stakeholder group. It's been a large and diverse group of folks who have provided input not only on prioritization but also in distribution, including members of the General Assembly and several representatives in the community. They started their work in September, and then not long after that, we began exercising at TEMA. They're our experts in emergency management and emergency preparedness. So we've been contingency planning and running through scenarios quite frequently and have been doing that on a weekly basis regularly. We'll be doing that again next week, as well as what we call an after-action review, or AAR, to look at what happened this week, what we could have done better, what we want to do better next week, and we'll continue that in the future.
So our communications team is talking about what the next role that we have in communications around vaccine. At the present, what we really think is the most trusted voice is our healthcare providers. It's a little bit different than the mask wearing message, but nonetheless, we will be using whatever methods we think are appropriate at the time and that we have resources for as a state. But at the end of the day, the healthcare providers are the most important messenger for the safety and the efficacy of the vaccine.
Governor, there have been a lot of statements about the achievement and significance of this day, and I certainly think that's something almost everyone in the room will agree on. But this day came in a lot of other states Monday, Tuesday, and Wednesday. And at this point, most states have already begun vaccination.
Right. Yep.
Why did that happen? Why was Tennessee towards the end of the line?
Yeah, I think Dr. Piercy addressed that earlier, but I'll say top line letter answer again. We had a plan that was very mindful of the desire to eliminate waste and to make sure that we were able to, when people are lined up to get vaccinated, that we would have a vaccine for them. That included a set aside on the front end that caused this date of this vaccine. Turns out that was helpful because we would have wasted part of that vaccine had we started 2 days ago, because only today have we been given the authority to use additional doses in the vials. But it was all a plan to do this in a way that's going to deliver as soon as possible, but to eliminate the risk of waste associated with moving ultra cold storage vaccines across the state. Do you have anything to add to that?
Does the state of Tennessee plan on getting these 9,000 doses on Thursday instead of on Wednesday?
The federal government decided the shipping dates for all of these. So they told us that they would be shipping, and then they determined the dates, and we didn't know what day actually it was going to ship until right before the day. So, Phil?
Governor, health professionals across the state have been begging you for a statewide mask mandate.
Yeah.
1 month ago today, you said, quote, "For now, what we believe is the strategy we're taking is actually working."
Yeah.
Since then, more than 160,000 people have been diagnosed with COVID.
That's right.
1,673 more people have died, and there are 1,000 more people hospitalized today than they were when you made those comments.
Yep.
Can you really say your strategy is working?
I think what I can say is that there's a great desire for us to mitigate the spread of this virus raging across America. Multiple states struggling with rising cases at various times in the pandemic. What we can say is that we are doing what we believe to be the very best at fighting this virus. We also believe that at the end of the day, the real people who will make the decision about whether this virus is slowed in their community are the people that live in those communities. And that's why I started off my comments today imploring Tennesseans, recognizing we're in a very difficult spot. That we can argue about tactics, but we can't argue about the fact that where we are is very serious, and why I need Tennesseans to listen to that message and think long and hard about what their gatherings look like in the days ahead.
If you have such respect for these health professionals, why not take
take their advice for a statewide mask mandate?
I talk to health professionals all the time, and that's not a unified voice. You know that. There's a lot of argument and a lot of dissension about what's the right tactic. We can argue about tactics, but we can't argue about what needs to be done. And by the way, Tennesseans need to wear a mask. It works. It's important. It is a critical part. There are different strategies to engage Tennesseans to wear masks, and there are arguments about which ones of those strategies will work. But let me be very clear to Tennesseans. We need you to wear a mask. If you haven't worn a mask, we need you to contemplate doing that. Wear a mask in honor of one of the 5,000 people that have died in this state, to honor the families of those who've had a struggle for this year. The tactics can be argued about, but the need for behavior cannot be argued about. And I implore Tennesseans to step up and to engage in a new way.
I think this is a Dr. Piercy question, but you know, I know it's all state by state, but you know, I saw a message in Iowa where they were warned you're not going to get all that you thought from Pfizer. I don't know if Tennessee has gotten a warning like that. Clearly, I don't know that we can count on these numbers that you're talking about. So have you been told that maybe you need to downsize what you're expecting?
We actually have not had any heads up on a reduction in numbers for the last 2 or 3 weeks now. The initial Pfizer, the final number that they gave us of 56,000 has held. Obviously, we'll see about that today if they all come in, but all of our facilities have received their tracking numbers. And as John mentioned earlier, many of them have already started to receive the ancillary supply kit to go with it. So to answer your question, I have not been made aware of any potential reduction, but having said that, all numbers are subject to change, and we get it sort of in real-time updates, so to be continued.
And so does this mean that those numbers we don't need to take as exactly what's going to happen in the next week? Even the Moderna.
As we get closer to each allocation, those numbers become firmer. So I'm pretty confident in the 56,000 today, as I am with the 115 that begins on Monday with the Moderna. After that, the numbers are a little bit softer, but there's a system that we can log into and see what's coming up for the next week. And as we get closer to time, those numbers get pretty firm.
Dr. Piercy, before you go on,
Sure.
I think it would help people understand this whole reserve issue if you could speak to whether other states are doing this as well, putting some of the initial vaccine reserve.
So there are, I think, 63 total plans. And to be perfectly honest, I've been so consumed with our plan, I haven't studied theirs closely. Every state does have a provision for emergency backup, but I'm unfamiliar with how they timed that and where they're staging it. You know, I think the key thing to remember here is that no two states are the same. And so whereas our population and our geography is different, we've got a plan specific to Tennessee.
Governor. Good morning, Governor.
Natalie?
You mentioned earlier that you're always considering other strategies and tactics. So can you share what those are and why you all aren't implementing any of those in an effort to try to reverse the trend recently?
I think we have implemented a lot of strategies over the last 2 or 3 weeks, including, as I reeled off, the use of the National Guard, the use of federal troops, the expansion of COVID-specific nursing homes, the additional funding for staffing for hospitals, the development of this distribution of this vaccine, the expansion of the types of tests that Tennesseans can get. As you know, we just recently announced that you can self-swab test in departments of health across the state, because it's important that while our departments are going to be very engaged in distributing vaccine, we also want to keep testing up in our state. So we had to pivot and change the way that we provided testing. There are a lot of things that we're doing every day to try and mitigate the spread of this virus.
So most of those things, with the exception of maybe the testing, are really dealing with treating people who have the disease, the National Guard, helping out hospitals, things like that. Is there anything else on the table besides, you said no to closing businesses, again, no to mask mandate? Are there any other big strategies the state could implement, you could implement?
Yeah. I think the best strategy that we can do is partner. It's partnering with local officials. It's partnering with departments of health. It's partnering with the media to get messaging out. It's utilizing announcements through PSAs and otherwise what's important in our state. It's trying to reach Tennesseans with the message that You and you alone can make the personal decisions that will responsibly curb the spread of this virus. Tennesseans and the decisions of some over Thanksgiving to ignore advice and to meet anyway resulted in cases that we couldn't have imagined the case rise that quickly, or we certainly didn't want to imagine that. Those are decisions that people have made in their homes and with one another that could have been made otherwise. That's the kind of messaging that we need to get out to Tennesseans. No mandate, no restriction, no shutdown is going to stop that kind of behavior. Tennesseans will stop that kind of behavior. And to the degree that they see this urgency of what's happening in our state, we believe that they will. But we need to make. Thank you all. Now, it's a historic day, and I'm especially, once again, just really grateful to Vanderbilt for letting us do this here, but also for the role that you play, actually internationally, in the research that's gone on here to develop vaccines, not just the distribution and the care for Tennesseans, but what the contributions that you've made to the country and to the world in this pandemic. You make all of Tennessee very proud, and we are very grateful for the work and very hopeful for what the day holds. So thank you all for being here.
So I'm still waiting on word about our vaccine. If you'd like to stay, we'd love for you to stay. We do intend to vaccinate our COVID unit staff in the interim. I think they would be okay if you'd like to speak with them. The other thing I could add is that tomorrow morning, our vaccine rollout here begins in earnest. We plan to vaccinate close to 1,200 of our frontline healthcare workers tomorrow. There's a vaccine site across the lobby that we could take you all. It's set up and ready to go for tomorrow morning. And you'd be welcome to take a look at that if you'd like to while we're waiting on the vaccine. Or if you'd like to come back, we could try and notify you about the vaccine's arrival and what time we think we could give it. So, thank you.
Don't mind. I don't know if you want to, well, kind of have you. You want it right here?